Hi, my name's Mike Deck, and I'm with Healthcare Synergy. And what we've done is put together this quick little video to kind of give you an introduction into some of the changes that we are seeing happening currently inside the healthcare market. And notice I said healthcare market, not just home health, but healthcare market as a whole. And what this changes and what we're seeing based on some of the work that we're doing, obviously with our software, but also some of the work that we're doing on a couple of pilot programs that are happening in some states. At any time, if you have any questions watching this video, feel free to email me at mike.deck@healthcaresynergy.com, and I will get back with your answers to your specific questions. Okay, so let's go ahead and get started. And again, as I said, this video was designed to kind of give you an update on some of the changes that we're seeing throughout the marketplace. And one of the biggest ones is that point of care and the methodology and some of the benefits of point of care is constantly changing. So let's take a step back. Remember when point of care came on the market probably about 10 to 15 years ago, right? The idea was, hey, for home care and hospice, we get our clinicians out in the field, we get them at the patient's house, they use some sort of handheld device, and they're able to, enter all their data, their visit notes, their OASIS, med profiles, right? And then that data gets electronically sent back to the office, and we're good to go. Well, we're seeing a fundamental shift now that is not enough to help us survive in a changing market. And by changing market, I mean we can see that, with the growth of accountable care organizations, the Healthcare Reform Act, the fact that, dual eligible patients are now becoming the new norm, that it's just not enough to have data collection. We got to start looking at data analysis. So there's an evolution from the data collection. And systems need to be smarter and assist the clinicians as they're doing their documentation. So for an example, let's say that our clinicians out doing an OASIS and they're using the Healthcare Synergy Web Edition. When they're answering their OASIS, let's say that they answer and they're going to get a warning that, hey, listen, you know what? You said this patient had a formal pain assessment and it indicates that they're in severe pain. Yet depression or feeling depressed or hopeless, they're not at all. Now, technically, those answers make sense because we answered the required OASIS. But clinically, it does not make sense. It's showing that something's just not quite right with this patient. And this is what I mean by more of a data analytics as opposed to just data collection. Now, to further go on with that, I had opened up with a presentation, or excuse me, a slide, with a report from Plante Moran, right? And it said that it was 3 articles that they wrote on state of changes in the healthcare reform, and one of them is about point of care. And they said point of care is changing, and I'm going to quote it here, and this is by David Crockett, Dr. David Crockett, and that moving beyond prediction onto prescriptive analytics. For large home health systems and academic medical centers, the small hospitals and healthcare startup providers are considering how to use data analytics to help them survive and thrive in a value-based reimbursement world. Healthcare organizations have invested a lot in EMRs. While a necessary investment, EMRs are not enough to achieve the triple aim of higher quality, improved patient experience, and lower cost. Why? Because focusing on data collection is a little like driving. While looking in the rearview mirror, it tells you where you've been, not where you're going. So, something to consider here. Obviously, the analytics that are being applied to our industry. But we're looking at the triple aim of higher quality, improved patient experience, and lower cost, right? That doesn't just apply to home health and hospice. We have to start thinking of ourselves as part of a full care team. That's going to include multiple providers. It's going to include DME companies. It may include like MRIs, lab results, primary physicians, specialized physicians, hospitals. All together, we're taking care of a patient. So what we want to do is take a look at how to share information among multiple providers. Now, a lot of this also comes down to the HITECH Act, and with this more emphasis on electronic medical records. And the HITECH Act is the law that basically dictates to the hospitals and the physicians that, hey, listen, you're going to get some Medicare incentive funds if you use an EMR. Well, obviously this doesn't apply to home care and hospice, unfortunately. But one of the things I wanted to focus on was there were three parts for the physicians and the hospitals to get their incentive funds. And that was that they had to be an eligible professional. They had to use certified software. But they had the one I want to focus on is they had to demonstrate meaningful use. Meaning that for these healthcare systems and for these hospitals and the physicians, it's not enough that they just install software. They have to demonstrate to the government that they're using it in such a way that they're achieving results. And this goes and comes along with, the point of care that we're doing in home care and hospice. And the reason, what is the correlation between it? And is that the collaboration of data has improved care for patients, right? So now, we're not thinking about ourselves as any longer as just the separate home health entity. We're part of this care team and this care team continuum. So we want to be able to share the data with everybody else, with the primary physicians. And maybe we're part of an ACO and we have a case manager that's looking at it. Or we're working with an IPA or another community-based organization. And it's no longer us that's going to be just looking and monitoring how well the patient's improving or stabilizing or unfortunately even sometimes realistically declining. But it's going to be the whole care team. And one of the best things that we can do is collaborate. Now imagine in your typical home care and hospice world if you got a referral and you had the capability of seeing, let's say it's a congestive heart failure patient, of seeing 2 years of just the weight for that patient to see if the weight gain when there's fluid retention going on. And that's just as simple, and that's what I mean by the collaboration of data. Not only looking at your agency's data, but having the access to look at the physicians, the laboratories, the DMEs, everybody else. So can that be achieved today? And the answer is yes. So let's kind of walk through a simple little example. We're going to be using, and part of the HITECH Act included the funding. Each state has what's called an HIE, or a Health Information Exchange. Not to be confused with a health insurance exchange, but a health information exchange. And this is how we're able to achieve the collaboration and the sharing of data. So a lot of times we think about our typical home care agency, we think about a patient, we think about very simplistic terms, right? That we got a referral from a physician to our home care agency for a patient. And that's our little care team. Now, 9 times out of 10, those cases are not that simple. That patient has a full care team, has a number of physicians, has a number of specialists, has different lab results, maybe has had some MRIs, maybe information from an urgent care, the home care, maybe spent some time in a skilled nursing facility. Our patients' histories are complicated, and what we want to be able to do is electronically share information among multiple providers. Now, it's pretty easy if, let's say, the two doctors, we have a general and a specialist, are in the same practice or in the same building. They're going to see each other in the hallway and they'll talk about them or they'll page each one and, very simple collaboration. But by the time you start bringing in, let's say, a third specialist or a third doctor and then another care team, and then you start adding the facilities, you can see that communication becomes a big spaghetti mess. Something can happen to this patient that's very vital, and not everybody would know about it. They'd be in the loop. And then to complicate things, each one of these physicians or hospitals or facilities can be using separate software. So let's say the physicians are using Epic and Cerner and McKesson. Home care agencies are using Synergy. MRI companies using the MRI software. Skilled nursing facilities using point-click care. And maybe the urgent care or another facility is using a homegrown system. And how are we going to be able to have the systems communicate with each other and exchange data? And that is where we also have to keep in mind that the patient comes first. We can get caught up in all of this communication. So we want to focus in on the patient. What's going to make it easier for that patient? Because you know that the patients oftentimes won't even remember what medications they're on from one day to another. So the central location for this information to be stored. That is what a health information exchange is. It's both a noun and a verb. And it is that the noun is the organization that provides the service. The verb is the capability of different systems to integrate and exchange data across multiple providers. So that is what a health information exchange is. So how can this information be shared among multiple providers? And now we're going to focus in a little more on healthcare synergy. And this is focused on basically one of two ways. The first way is the push and pull methodology, meaning that it's automated in the software. So if you want inside the Healthcare Synergy Web Edition, under the patient's chart, you have the capability of sending and receiving data from an HIE. So this is done through an integration that we've done with the state level HIE. The second thing is that each HIE in your state, let's say we don't have an integration fully developed with your state yet. So each state still has an HIE, and it's still a very valuable resource because they have what's called a VHR, or virtual health record. And so what this allows you to do is to go to a website, log in, and see the data. And there's a lot of data that's being shown on here. So just an example that I have up on my screen, you can see the lab results, you can see some reports that came in, you can see some radiology reports. And we have a big one, especially for our industry, and it's called ADT. And I'll cover that here in a second. So we have two ways that we can share this information among our agency, among multiple providers. First one, again, is the integration that's already built into the Healthcare Synergy software. The second one is through what's called a virtual health record. So what type of information can be shared? And remember on the previous screen, I said ADT. That is admission, discharge, and transfer. And what this is a simple message in the system that says, hey, this patient has been admitted to this facility at this day and time. And that's gone right into the system. And this patient, with the discharge and the transfer. And so it's very, simple that, hey, when you admit a patient, through the HIE integration, all the other providers would know on this care team that have... all the providers would know that you've admitted the patient. Now, let's say in a realistic term that, we're visiting this patient on every Wednesday, once a week, right? And so the caregiver goes in to visit the patient on Wednesday and then goes out the following Wednesday, knocks on the door, and the patient's not there. And this is a realistic scenario, right? And we find out that, talking to the neighbor or talking to a relative, that patient was admitted to the hospital on Saturday morning. So we, as a home care agency, we spent the money sending the caregiver out to see the patient, and we didn't know where that patient was. We didn't know the patient got admitted to the hospital. Through the HIE, we would also not only be able to send this ADT information, we'd be able to receive that as well. Now, on top of that, that's ADT. On the second thing that the HIEs allowed us to do is to do what's called transcriptions. So we can take portions of documentation and send those into the HIE so other providers that are on that care team. So when I say other providers, I want to make a quick asterisk here. I don't mean other home care agencies, but I mean other care team members that are seeing this patient would be able to see things like your current orders and goals on your 485. And that's something that we're actually doing today with one of our pilot programs. And you'd be able to see transcriptions from other things. For an example, some lab results that would come back in. You'd be able to see the same thing that the physicians are being able to see. And why is this important? What's the real world benefits? Well, number one, I already talked about it, the ability to know where your patients are. So knowing that, hey, this patient got admitted to an urgent care, and now the urgent care is transferring them to the hospital. And all this flowing in without you getting on the phone and trying to track down the patient. And I'm sure, the patients are going to call you and say, hey, could you tell Nurse Jane to not come out and visit me because I'm in the hospital, right? Knowing where your patients are. The second one, I mentioned it before, is the ability to review the vitals and a complete patient health information, or PHI, prior to the plan of care creation. So let's say, going back to the simple example of a congestive heart failure patient, if we see that they regularly for the last 5 years have a weight fluctuation, a weight gain loss of, let's say, 5 pounds, that's normal for them, right? Within a couple of days. Well, obviously for some people it's not normal, but for this particular patient it is. So when we create our goals for our 485, we wouldn't say notify the physician on a 5-pound plus or minus, because that's normal for the patient according to their past. We would probably do plus or minus 10. So the capability of actually being able to look at the data for the patient prior to the plan of care creation. And also the ability to work closer with a full care team. Now, as we move into accountable care organizations and we move into more value-based reimbursement from private duty insurances, we're seeing that growing in the industry. We need to consider our home care agency as a team member and not just a single entity. We're going to be working closer with people outside the confines of our office. And this is one of the realistic ways that we can share the information. Healthcare Synergy is not an HIE. We are very progressive on this. We're doing a pilot program in the state of Michigan. We'll be publishing results here in the fall of 2014. But what we have done is partnered up with an HIE here in the state of Michigan that uses what's called the Optum platform. So we also partnered up with Optum to develop this interface. But we use our system to push and pull the data automatically, and we've developed the interface. Now, while we're working with Optum, there's some other software that HIEs use that we're starting our dialogue with to develop these type of interfaces. But I want to let everybody kind of understand that Healthcare Synergy, we're not an HIE. But what we have done is develop these relationships and these interfaces with the state level HIEs so you can get this information. So how's this being done inside the Synergy web application? And number one is we have to have our permissions. And so everything is set on a permission-based level, as always with the web-based application. So if you are signed up with an HIE and we've got your interface open, the very first thing that you want to do is go into your user rights and make sure that you have the permission to go ahead and transmit the HIE data. And that's done under the patient file, and there's an item there that says send HIE messages. So once we have the permission, what we're doing is it's set up on a per patient. So all your patients don't automatically transfer their data into the HIE. And the reason being for this is because some patients, I don't want this. I don't want my information shared electronically because I'm very nervous about that. Now, obviously, just on the security side, with the HIE, everything that we do is completely secured through encryption, private tunneling, and SSL layers. There is a ton of technical specifications that we use to ensure that this data is protected. However, that's still not good enough for some people. And so you have the capability on a per patient whether or not you want to share that information with the health information exchanges. And this is done through the patient's chart. There's a tab now that says HIE. And when you get there, you'll also see that we've got 3 buttons: and send admit, send transfer, and send discharge. And let's talk about those 3 for a second, because they're a little bit different than just, hey, we're admitting the patient. What happens when you subscribe a patient to the HIE is it does 2 parts. We actually send the data up to the HIE that says this patient's now been admitted to the home care agency. But we also subscribe your agency so you can receive real-time feeds on that patient from any other provider that's in the network. So we have to create a subscription for that patient. So that's what that send admission button does. It will not only send up the admission, but it will also allow you to subscribe to that patient. Transfer, it sends a transfer notice into the system that you've transferred the patient out of your agency. And discharge, it will actually unsubscribe you from the patient's feeds. Now, what we're doing with our initial pilot too as well is on sending admission, we're sending a plan of care with when sending the admission, we're sending a transcription of the plan of care of just the following narratives. The orders and goals are being sent up to this health information exchange as well. So when you click on that send admit, it's going to automatically send a copy of your orders and goals for your current 485. Now this is not data that CMS is going to come in and monitor and regulate and use for payment. Okay, I want to make sure you guys understand that this isn't stuff that directly affects your billing. What this is this is how you can collaborate with your physicians, all right, and send them data and also receive data coming back in as well. So we got two parts. We want to transmit and we want to receive the data. Receiving the data, that what will happen is that when a feed comes in inside the Healthcare Synergy, we've got what we call our WeMail, our secure communication system built into the web app. And what happens when a HIE feed comes in, it will actually be sent to the mailbox. So again, this was just a very quick video to kind of start talking about what an HIE, getting you used to what an HIE, to see how that we're able to take point of care data and now make it part of a full care continuum, as well as provide your agency with some resources that you can use to go out to your physicians and your hospitals in your area. And what I mean by that is, remember how we talked about the HITECH Act, right? And that we had to demonstrate, the physicians had to demonstrate meaningful use. Well, one of those meaningful use requirements is that at least 10% of their patient population, they electronically exchange data about that patient to another provider. So why can't that provider be your agency? Something to think about. All right. If you have any questions, this was just a quick video, feel free to email me. Look for other videos and white papers coming out shortly. And also in the fall of 2014, look for our initial pilot program, the results to be published. Thanks so much and have a great day.